Everyone to Coffee with Doc P. This episode is focused around the question, should I see a chiropractor for a disc herniation? In short, the answer is yes. Yes, you should. As a chiropractic physician, I am trained in neuromusculoskeletal conditions, meaning anything to do with the nerves, the spine, the muscles, or the joints. We are trained to properly assess and do a great examination and provide non-invasive treatments for these conditions. Now, the important part of this is we are highly trained in the examination of the condition or injury, which means if this is something that requires more invasive treatments or a deeper look into it by an orthopedic surgeon or someone of that nature, we have the ability to refer you. You do not need a referral to see us, and we have the ability to refer you elsewhere, order imaging, or order any tests that we deem necessary. So, costs are a lot lower by initiating care with chiropractors. And that is because we typically provide treatments that are more financially sound for the patient. We start very non-invasively, and we stay non-invasive, and we provide treatments that just in general are cheaper because it's not requiring medication or any kind of in-depth test or procedure that takes many hours or anything like that. So all the current research says that if you initiate care with a chiropractor in regards to an injury, ache, or pain, you are likely to save that money. Now, if our treatments aren't what you need at that point in time, like I said, we know how to get you to where you need to be. But for the most part, we help a lot of people with anything that deals with the nerve, muscles, or joints, any pain or injury that you may experience. So I just want to share with you some current research from 2020 on disc herniations and non-invasive care. So this study reads, and it's from Global Spine Journal, a study of more than 250,000 lumbar, low back, disc herniation patients reported that 97% were successfully managed with non-operative treatments. This is great news. This means 97% of the 250,000 patients that were involved in the study avoided surgery. And that is key because if we keep to these non-invasive treatments, like I said, it's going to save you a lot of money as the patient. It's going to save the healthcare system a lot of money because a lot of insurance companies and big facilities and companies like that are not having to fork out a lot of money for something that can and should be treated first with the cheaper and more effective option. So, quote, our results suggest that the majority of patients are successfully managed non-operatively. However, in the subset of patients that fail conservative management, male sex and prior opioid use appeared to be independent predictors of treatment failure. So, just to drive this home again, yes, absolutely, I would see a chiropractor for evaluation and treatment of a disc herniation. Myself, here at Southern Spine Rehab in Marion, Illinois, disc herniations are one of the top conditions that people seek us for. We get great results. We are providing not only treatment here in the clinic, but we set our patients up with an app that has a very, very specific exercise and home routine to put people on in between visits, and it really keeps them from having to come see us every single waking moment they're in pain. They're able and taught to control, manage, and stabilize the area at home. That way when they come in, we get done what we need to get done, and overall they recover a lot faster and they see great results. Now, there's been other studies out there. I don't have it pulled up with me here on my iPad. However, I'm going to paraphrase. There's a lot of research out there that suggests that people who have asymptomatic herniations, there's more people out there than you think with these disc herniations that are asymptomatic. So another way to put that is if we pulled 100 people off the street and ran them through an MRI of their low back, odds are quite a few of them would have some kind of disc bulge at some level throughout the low back, but they never knew because they never had pain. Well, does that mean that we should immediately put them on the surgeon's table and perform surgery on it? No. They're still able to function. It's not even causing them pain, so why fix something that's not broken? However, if eventually it does cause them pain, then they should start out in the absence of red flags such as like a major motor vehicle accident, or a lot of things your doctor should know they need to look for before laying hands on you and treating you. In the absence of all that stuff, which is a small percentage of people with the disc herniation, in the absence of all that stuff, care should be initiated with non-invasive treatments because there isn't as much risk. There's very, very minimal side effects to non-invasive treatments such as chiropractic manipulation, adjustments, therapeutic exercise, corrective exercise, any kind of treatment you might get at your physical therapist's facility or in a chiropractic clinic or massage therapy, anything like that. Generally, the biggest side effect that comes with that stuff might be soreness, just from being worked in a way that your muscles and joints and everything haven't been worked in a while or moved in a while that way. So, but obviously there's a lot more side effects with things like injections or surgery. So typically we try to utilize the treatments up front that may have little side effects, low risk, high reward. That's kind of how it's looked at. And there's guidelines to guide us in making these clinical decisions based on the current research, our clinical experience as a doctor, and obviously your preference as a patient. What are you looking for as far as goals go in the clinic or your treatment? So if you have any questions, please feel free to reach out. Chiropractors are highly trained in treating disc herniations. I know that some people might be scared that getting adjusted may make the herniation worse. If you are absolutely against getting adjusted with the disc herniation, good news for you is we are trained in many different ways to treat people. There's many different techniques, many different ways to achieve the same results. It just may be a different way we utilize to get to that end goal. So all those random videos you may have seen online of all these crazy adjustments and things like that, I can assure you that is far and few in between when you walk into an actual clinical setting, an actual doctor's office, and most of those videos are used as a way to gain followers because it's interesting, it's weird, it's different, and people are attracted to that and that popping noise and things like that. So I wouldn't make your final decision based on these bizarre videos you've seen online. I can promise you, walking into an actual clinic where the doctor's there for you, you will get a better experience. So if you liked this video, please give it a thumbs up, subscribe to our channel as well, and please follow us on Apple Podcasts, Spotify, and Google Podcasts. If you guys have any questions, feel free to reach out. Thanks. Have a great day.